Dementia is a general term for loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Disorders grouped under the general term dementia are caused by abnormal brain changes. These changes in brain cells affect their communication with each other, affecting a person's thinking, i.e., cognitive abilities, behaviors, and feelings. There are many types of dementia. Alzheimer's disease is the most common type of dementia. Vascular dementia is the second most common cause of dementia, followed by frontal-temporal dementia and Lewy body disease. While there are various causes of dementia, the observable characteristics are similar. Signs and symptoms of dementia include forgetfulness, impaired decision-making, and decreased thinking abilities that interfere with daily living. It is gradual and progressive, meaning the signs of dementia start out slowly and gradually get worse over time. Some examples of decreased thinking include changes in the ability to perform the following actions: recalling things from short-term memory, keeping track of a purse or wallet, paying bills, planning and preparing meals, remembering appointments, traveling out of the neighborhood. Dementia typically starts later in life, but it can begin as early as the mid-40s. It is not an expected part of aging. There is no cure for dementia, and the effects are irreversible. However, appropriate care improves the safety and the quality of life for individuals affected by dementia and their loved ones. About 10% of people older than 65 are affected by Alzheimer's disease AD. AD is the most common type of dementia and accounts for 60 to 80% of cases. Changes in the brain may begin a decade or more before impaired short-term memory and other cognitive problems appear, and the brain's functioning continues to decline over time. Scientists continue to unravel the complex brain changes involved in the onset and progression of Alzheimer's disease. Abnormal deposits of proteins occur throughout the brain and form structures called amyloid plaques and tau tangles, causing previously healthy nerve cells, neurons, to stop functioning, lose connections with other neurons, and die. The damage initially appears to take place in the hippocampus and the cortex, the parts of the brain that are essential for forming memories. As additional neurons die, more parts of the brain are affected and begin to shrink. By the final stage of AD, damage is widespread, and brain tissue has shrunk significantly. See the image above comparing a healthy brain to the changes that occur during AD. There is no single diagnostic test that can determine if a person has Alzheimer's disease. Healthcare providers use a patient's medical history, mental status tests, physical and neurological exams, and diagnostic tests to diagnose Alzheimer's disease and other types of dementia. During the neurological exam, reflexes, coordination, muscle tone, and strength, eye movement, speech, and sensation are tested. While there is no cure for AD, there are medications to reduce progression of the symptoms of memory loss and confusion, as well as interventions to manage common symptomatic behaviors.